Anybody found anything else with some of the potential problems? What you can do, or any problems that you've seen? Okay, nothing?
I obviously I'm not very many, but one of our nurses that used to manage an ICU, she said if they turn their head in the opposite direction, like it's on the side, and they turn their head in the opposite direction, she has better luck, like if one's not flowing. So, I don't know,
It's like
I've never
if you
done
aren't,
it, but that's what
straighten
she
it out.
said.
And then turn the head the opposite way, straightens it out.
A lot of people that have had these for a while will know what works for
What
them.
we're doing. Very good point.
Or the caregivers.
Or the caregivers, utilize those folks. This is one of those times where absolutely utilize their expertise. Air embolism, Tim talked about this, and so did Erica. You just clamp immediately. You turn the patient on the left side, the head down so the air enters the right atrium and pulmonary artery. Maintain this position for 20 or 30 minutes and get them to somewhere that can work, help. This is the one we see quite often, subcutaneous vascular device, access devices, or portacaths. So we know them, I mean, for those of us that have worked in the ER, we're used to seeing them as portacaths. SVADs is that other terminology. They're a venous access device that have an injection port, and the port includes a self-closing septum for repeated injections. It requires a Huber needle, and Chuck and I tried to order this stuff a couple of weeks ago, and we never got it in, or we get to play with it. If we get it in before the end of the refresher, I'll bring it that day, just so that we can play with it, and we've got the mannequin out here.
Do you have a
Yeah.
picture of one?
Huh?
Do you have a picture of one?
I don't think, I don't think I do, Huber needle, here's the needle
There you
itself.
go. Yeah, they look kind of like a hook.
The hook goes right into that, and I'll show you the actual port out there, but there's a technique to it. The big thing is if you're drawing blood with this, you throw away the first chunk, and the next one is the good, you have to discard the first. And I think Kate kind of talked about this a minute ago too, so.
That's kind of
These
true
patients
with
will
most
actually get
ports.
back that blood.
You don't know, sometimes you don't know if
Did you
they're
see that?
heparinized or not.
Right.
They'll actually, because pediatric patients are so volume depleted or volume,
Or they can get that way quickly.
you pull back the first one, and then you save it, and then, I think they're teaching that in, analysis, is it?
So they're giving that blood back.
And they're giving it
instead
back
of
to
saving
them.
it.
Really?
Yeah.
Wow.
I thought that was like, wow.
The Huber needle is a special needle too, because it's made to hang, but where the fluid comes out is not out the tip. The fluid comes actually out the side of that dang needle.
Oh, here, hold on, there you go. So you're looking at right there.
Up a little higher, right there. You can see that, I can see the little mark where the hole is from here. It comes out the side of the needle, it does not come out the tip.
Because the little hook is what
what
penetrates
hooks,
through
yeah.
first and then goes down. Yeah.
So like I said, when they come in, apparently it was challenging. Everybody wants them, I guess. So they were back ordered. So we'll get them, and then if it's in time for the refresher, it will come and play. I would have tried to borrow one from the hospital, but I didn't get a chance to go up there. We were up there on Sunday too, and Linda and I forgot. But. So then it talks about how the port works. And I'm going to put this on Blackboard so you can actually I'll have Sue put it on Blackboard so you can actually take a read it and see how the port access
Linda
works.
can
I
access.
can't read it from here anyway, but you'll be able to have it there. So any questions, thoughts, issues on any of these?